Good afternoon, everyone. My name is Carlos Moreno, Scientific Director of the ETI Chair, Entrepreneurship, Territory, and Innovation, a research lab based at Paris-Sorbonne Business School, Paris-Sorbonne University. We are specialized in urban and territorial transitions. Today, we are going to discuss the concept and applications of an innovative urban vision centered on proximities, also known as the 15-minute city and 30-minute territory models. I have been studying this theory for several years. With my team at the ETI Chair, we have developed the scientific toolbox to implement the principles and measure the ultimate outcomes of this approach, the high quality of societal life. The 15-minute city concept is a response to one of the most important challenges faced by cities, improving quality of life through the systemic integration of access to essential functions and community building. It is a vision and an urban planning model that advocates for a human-centered urbanism. The idea is simple. Instead of spending hours on ending transport, we can bring all the essential things that people need closer to them. It is a proposal to redesign the organization of the city so that residents can access their 6 essential needs: to live, to care, to learn, to enjoy, to work, and to supply in a time frame acceptable to most people, which is how we ended up in the 15 minutes ballpark. It is a paradigm shift from a car-centric to a proximity-centric urban planning approach, putting cities, livability, and sustainability as the ultimate goal. Rather than being a universal rule, the 15-minute city is a generic model that can be adapted to each and every local context, inspired by the initiatives of local actors. As an example, we talk about a 30-minute accessibility reach for medium or low density territories, such as villages and suburbs. The mayor of Paris, Anne Hidalgo, has embraced this concept in 2018 with a holistic plan as the backbone of the new urban policy. I'm going to share now the main strategies that have been adopted, and I will illustrate the related transformations achieved in Paris. As a result, a new urban and organizational dynamic is in progress with visible improvements for inhabitants and visitors, and more change is to come regarding urban policies and neighborhood planning projects. The 3 strategies are: first, foster carbon-free and active mobility. Secondly, densify and mutualize public services and amenities. Thirdly, rehumanize the city to encourage sociability and care. Strategy number 1. Being able to move around in a local area is essential to make 15-minute city possible. The public transport network is very well connected in Paris. Therefore, the agenda there is to reduce private cars with a target of 50%, while ensuring cycling-friendly environments through the creation of more bicycle lanes in the city. The COVID-19 crisis was a radical turning point. A lot of major roads were closed to car traffic and transformed into bicycle lanes, which have stayed that way since then. Reclaiming space from cars is also illustrated by the creation of more pedestrian streets, the expansion and revegetation of sidewalks. Thanks to these measures, residents will be less likely to use their car to go to work, buy groceries, or pick their children up from school. Strategy number 2. If people are going to ride their bikes or walk in their daily life, they need to find the majority a very basic need in their neighborhood among housing, working, healthcare, groceries, learning, and entertainment. Public services and amenities have been mapped, and the objective is to ensure that the majority of people have a reasonable access to all, or at least a majority of 6 social functions using active mobility. In reaction to the COVID-19 crisis, for example, health services and city medicine have been reinforced thanks to a partnership with the Assistance publique des Hôpitaux de Paris, the Parisian public hospital. Strategy number 3. The 15-minute city concept aims at bringing people closer to one another. In Paris, it takes the shape of 3 important programs. A school as neighborhood hub with pedestrian access, streets for kids, rues écoles, nature-based solutions in the schoolyards, cour oasis, and access to schoolyards for the public outside of school hours on weekends and during school holidays. This initiative has met with a great success in a city where space is limited. Participatory urban planning initiatives, our participatory budget to empower residents to choose and propose projects. The Beautify Your Neighborhood methodology, with more vegetation, pedestrian areas, cycle paths, and street furniture adapted to new uses. The neighbor decide on useful and priority interventions to make their neighborhood or streets a more pleasant, more accessible, and more breathable places. In this very short introduction to the 15-minute city concept and its pioneering implementation in Paris, I hope we have reached a common ground in understanding that proximities are the foundation of the urban strategies we need to improve community health, livability, well-being, and accelerated climate actions. This is, of course, just an introductory course. We did not cover the scientific process of transformation to create a systemic impact at neighborhood and city scales. In conclusion, here are the 3 lessons for policymakers and city officials. Firstly, the implementation of carbon-free and active mobility, walking and cycling, to promote a healthy mode of transportation for the planet and for the people and change their rhythm of life. Secondly, cities need to question the organization of public services and amenities so that people find their basic needs in their local areas. Partnership and public investment might be useful. However, it is possible to maximize the use of the existing buildings. Thirdly, simple actions can be implemented to make the city more pleasant, human, and lively. The participation of local residents is very important to achieve the goal of creating a more human city.